you for joining us. I think you heard Michael a little bit there. He says he agrees with you and your effort to make sure that there's funding in any sort of healthcare repeal effort to address the opioid situation, but he wants to know where that money would go. What would it be used for?
Well, Greta, first, thanks for having me on. And I did hear the end of Michael's question, and he's right. We have a crisis right now, and we need to ensure that we're having not just the ability to get people into treatment, but even longer-term recovery, because we know that's more successful. And I've probably met with 1,000 or more recovering addicts or addicts in the last few years alone as we put together this legislation that's called the Comprehensive Addiction Recovery Act and also the Cures Act. And the notion is to get the money to treatment centers so that people have access to treatment, but also sober housing and longer-term recovery, because again, we know that that is going to lead to more successful results. And that's what we've been promoting, of course, in the recent healthcare debate as well. There's a $45 billion fund that is part of the Senate package that we voted on the other night that would provide the states the funding to be able to continue what is already there, which is called the Cures Act, although it's now going to be at a higher level. And the $45 billion figure was derived because there is a good study out there in the Journal of American Medicine done by researchers at Harvard and NYU that says about $4.5 billion a year is used by Medicaid expansion for the treatment of opioid. In other words, that people who are addicted are getting treatment through the expansion. We want to ensure those people continue to get access to treatment because the alternative is far worse, which is overcrowding the emergency rooms and frankly ending up overcrowding our jails and continuing to commit crimes that are associated with paying for the addiction habit and not going to work and not being able to achieve their God-given purpose in life. And all of those are bad results. And so in a state like mine, where we probably have sadly over 200,000 people who are now addicted, we need to be sure we are getting people into treatment. We think that probably 8 out of 10 people who should be in treatment are not in treatment. So there is unfortunately, again, a tough situation now where you've got a higher demand than we have treatment facilities. So we don't want to reduce that ability to have access to treatment. We want to get people into treatment. Longer term, the solution, as was talked about a moment ago by Michael, is prevention and education. We've got to redouble our efforts there immediately, but that really is something that's got to happen, in my view, starting very young. I think it's a K through 12 proposition, and then continuing this effort as Mothers Against Drunk Driving did, as we did with regard to smoking cessation, for everybody to be able to understand the dangers of opioids, specifically the connection between prescription drugs that are painkillers and the opioid crisis, because many people don't know that and inadvertently, really through an accident or an injury, often get involved in taking pain medication that then causes an addiction, a physical change in their brain to become addicted. And that's something we can certainly address directly through an aggressive public service campaign that is simply not being done now. You recall, Greta, back in the 1980s, the big effort with regard to the anti-drug effort. It did have results. We did have a reduction at that time in the use of drugs. And we need to get back to that again, in this case with regard to the opioid crisis, prescription drugs, heroin, the new synthetic heroines like fentanyl that are sadly flooding into our country.
Senator, your colleagues on the Joint Economic Committee, the Democrats on that committee, have put together their analysis, and they say the $45 billion that you've pushed for falls far short for all states, including the state of Ohio. They say the opioid treatment could reach $220 billion by 2026.
Well, $45 billion is a lot of money, Greta, and it's historic, it's unprecedented. We've never tried something like this before. I'm not sure what numbers they're talking about. I suppose they're saying that with regard to treatment across the board, that's true, but this is just in addition to treatment across the board. In other words, it doesn't say that there wouldn't continue to be treatment, so I'm not sure what number they're talking about. The $45 billion, if it were distributed to the states in the way the formula works under what's called the Cures Act, which is the current law, which provides for $500 million a year instead of the $4.5 billion that's being proposed, that formula would result in a state like Ohio, for instance, because we're one of the states, unfortunately, that's hardest hit, receiving about $240, maybe $250 million a year for this purpose. We've never had those kinds of funds before, so let's be sure that we are, using the money wisely. The one thing that I think is really important is that when you have a program like this, that you ensure that the funds are being used in evidence-based programs, that we're not just throwing money after a problem, but that we're actually using it in a way that focuses on what works. And I mentioned earlier some things that work better than others, including this longer-term recovery reality out there that we spent 3 years researching before we came up with our Comprehensive Addiction and Recovery Act. We had 5 conferences here in Washington. We brought in experts from all over the country. What's the best practices? What's working in Maine? What's working in California? What can be spread around the states? And the funding is directed at those kinds of purposes. So we need to be careful here that we aren't just coming up with new funding, but without the kind of evidence behind it, the kind of science behind it to know that it's working, whether it's prevention or treatment or recovery. So this is a tough issue. It's the #1 cause of death now, surpassing car accidents in my home state of Ohio. And most people think it's the #1 cause of accidental death now in the country. We have a drug epidemic that's worse than we've ever had in the history of our country. I've been involved in this issue for over 20 years. I started my own anti-drug coalition in Cincinnati, Ohio, that's still in existence, about 22 years ago. And it's changed a lot since then. At that point, it was more focused on cocaine, more focused on marijuana, to a certain extent methamphetamine, because crystal meth was an issue as well. And then we saw the prescription drugs sort of creeping into Ohio, and that has translated now into this issue of opioids, which is prescription drugs and heroin, and now this new synthetic heroin. And frankly, in my home state, the biggest increase we see right now is the synthetic heroines, fentanyl, carfentanil, U4. And as you know, Greta, this comes in primarily by the U.S. mail system, primarily from labs in other countries, primarily China. And as you know, I've got legislation called the STOP Act with Senator Klobuchar, bipartisan legislation, to at least require the post office to require that there be advanced information as to where a package is coming from, what's in it, where it's going, so that law enforcement who strongly support our legislation can identify these packages and keep some of this poison out. The current situation is really scary, where people are getting fentanyl through the mail and then distributing it and using it. And frankly, it is more deadly than heroin, probably 50 to 100 times stronger, and it's resulting not just in more overdoses, but more deaths per overdose. So we've got a real crisis on our hands.
And so given the crisis, the situation in your state, the fact that you've worked on this for so many years, if in the end there is only a skinny repeal, if you will, to vote on, that is, it repeals the mandates on individuals and employers and takes away the taxes, if that is the final package that you get to vote on in the Senate, and it doesn't include funding for the opioid crisis, will you vote for it?
Well, we'll see what's in the final package. I don't know what's in it. I've heard about 4 or 5 different descriptions. You just gave one. It's possible. The $45 billion is focused on those who would not continue to be covered under the Medicaid expansion, and that skinny package you're talking about, of course, would not include dealing with Medicaid expansion. So some would argue that that would continue the coverage that's out there now, and that might be better. I don't think that's better for the country, not to have a replacement for the Affordable Care Act. I don't think that it's working for Ohio or our country. We, in terms of the Affordable Care Act, to back up on that, we now have 19 counties in my home state without an insurance company in the individual market. This is the exchange market. And another 27 counties with only one insurer. That's not competition, and that's one reason prices have gone up dramatically in my state. About double for individuals, about 82% for small businesses. And this is premiums, of course, but then we've also got skyrocketing deductibles. So a lot of people who have health care tell me, Rob, it's like I don't even have it because my deductible is so high. So these are issues that do have to be addressed, and the package you just talked about, in my view, wouldn't address those issues, and they'd leave a lot of people high and dry. So I would hope we can do better than that we can do more than that and include the $45 billion as we talked about. But we'll see what that package looks like. I do think the Affordable Care Act, the status quo, is not sustainable. It's not working for Ohio, and we need a replacement, not just a repeal, but a replacement that really works.
Well, Senator Rob Portman, Republican of Ohio, we thank you for spending some of your day with us this morning. I know it's a busy day for all of you senators with this debate on health care, so we appreciate it. Thank you very much.
Thanks, Greta. Thanks for having me on. Thanks for your focus on the opioid issue. Just by talking about it, you'll be in a position to help people and save lives, because this is a true crisis, and the more information people have, the better off we'll be.
Yeah, we appreciate it, Senator.